שלום, שמי ארי ברץ, אני מעדיף באנגלית אם זה בסדר איתכם. And this is Dr. Librak, my colleague and mentor, and we are from Toronto, Canada, from the CReATe Fertility Center. We're really excited to be here because it's a special place for both of us, and I think this is an amazing conference and a huge honor to help you out. What I'd like to do is, this is an information session, but I've met some of you through the conference. There's a few points about what separates the CReATe Fertility Center in Toronto, Canada, from other areas, and then maybe we can open up to questions after that. It may answer some of the questions that you have. So the first is experience. So we have 20 years experience, Dr. Librak a little bit more than myself, I'm about for 10, 12 years of doing high-level IVF. Our experience is both clinical experience that we do many cases. We currently have approximately 100 cases going through. We also have research experience. We published our work on surrogacy, same-sex males, single males, probably some of the first studies in the world that have been published. So we're very interested in this area of fertility care. The other is quality. Very often people have concerns, well, okay, I know that I can go to India or Nepal or Georgia, Ukraine, or I can go to the United States, but this Canada, what about the quality? And I think it's not a coincidence that we're the only Canadian center here. We are a very high quality center. We probably are one of the top, if not the top center for surrogacy and egg donation in Canada, probably one of the top in North America. We use the same state-of-the-art IVF facility, ICSI, PGS. Many people consider Canada like the 51st state of the United States. It's this pretty much it's the same type of techniques. And so really we have no concern on the pregnancy rates or the quality or the outcomes. The other, I would say, big issue is, well, the country of Canada. Canada, I don't really know much about Canada. Canada is probably one of the most stable countries in the world right now, other than our Canadian dollar, which is very low, which is good for you. But we are stable when it comes to our openness, our patient-centeredness. We do not have any laws that discriminate or restrict against sexual orientation, marital status, male gender orientations. So we really are quite open that way. Our laws are very supportive of that. In fact, our current Prime Minister, his main preoccupation is with legalizing marijuana and climate change. He doesn't really, but it was his father, which is interesting, was the first Prime Minister to legalize same-sex relationships, and he was very famous in saying that Canada has no place in the beds of Canadians, and that definitely carries through. Specifically to our center, we are very active in the LGBT community, as well as in the surrogacy community. I think I've never had someone feel uncomfortable in our center. It's certainly a big interest of both myself and Dr. Librak's. The other big benefits I would say to our center is cost. Obviously, it's a very expensive process for you. That creates a lot of stress, and it's not completely inexpensive in Canada, but the price point, I would say, when we summarize it, it's about 30 to 50% lower than the American counterpart with the same quality of care. The main drivers there are our dollar. As you said, it's about between 30 to 40 cents to the American dollar, so it's lower. We also have some advantages. All of our surrogates, when they're pregnant, have universal health care. Every person in Canada has universal health care. And the care for the baby is a separate issue, but the insurance for that newborn is not very expensive. So that can be very difficult if your baby comes early or the surrogate's having issues. Every time they have to go to the hospital or need some procedure, it becomes more of an expense.
In the U.S.
In the U.S., whereas for us, those expenses are very minimal. And there's no extra cost for any of the medical issues. And I would say one of the last points, which is probably the most important, is the idea of patient-centered care. You're very far away. You have a beautiful country here, we love this place, but you're not in Toronto, or you're not in Canada, you're not with your surrogate or your egg donor, and you want to make sure that those people are being taken care of with the highest respect, that your interests are being taken care of, that the people who are taking care of you know what they're doing, that they're available. Every one of our patients is assigned a specific one-to-one nurse, And that nurse, we're open 366 days a year. If there was an extra day, we'd be open. We're open every day of the year. And those nurses are constantly in communication with the egg donor, with the surrogate. They cover each other if one's away. We cover the doctors. There's 4 doctors, Dr. Librak, Dr. Baratz, Dr. Glass, and Dr. Sharma. All of our doctors are available as required. And so I always, I say this jokingly, but I guess it's half true. I tell people, if you get pregnant, you blame us, sort of. If you don't get pregnant, you also blame us, sort of. Which means there's accountability. If it goes well, it's very easy for everyone to be happy. If it's not going well, we need to analyze. We have to see what has been the problem. What were the issues that were identified, and who's going to help you identify them? And if there's so many doctors taking care of you and nurses, it's very difficult to understand the case. One other point I want to mention about the technology is very often people think that in Canada they may not be getting the same level. Our center, and I'm speaking specifically about CReATe, I say CReATe and Canada together, but we're the only Canadian center here, so I guess we are Canada. We are a referral center, so we actually very often get more difficult cases where it failed in the United States and they want our opinion, or cases that failed in other parts of the world. Every day between the two of us, we're doing consults in almost every country, I think, except for Antarctica. I've yet to have, there's a penguin, I think, that came to us. But no, so we're very, I would say we're very international in that way. We have ability for translation in almost every language. אין לי כל המילים טכניים, אבל למדתי מה זה עיבור ומה זה ביציות וזה פונדקאות. I find it interesting that pundak means little hotel. So that's the camera guy's laughing. Another common question I get asked, and then I'll let you guys ask questions, is, well, how much of a commitment is there actually going to be? Like, how much time in Canada? And we think that pretty much it's going to be probably 2 visits. We do accept frozen sperm, frozen eggs, and frozen embryo from anywhere. That's the nice thing about Canada, is that we have like an FDA, but it's not as strict, so it's quite helpful to get all the products together. But you probably look at 2 visits. 1 visit to provide the zera and maybe meet the surrogate and meet us in our location, and then the other is, and if you're not using egg donor, to provide the eggs, and then the other would be at the time of the birth. So at the birth, there's a longer visit, probably somewhere around 2 to 4 weeks, depending on when the baby's ready to travel home with you. One other question that was asked before is that, who are all the players, like who are the people involved? So we're the physicians, so we run the fertility center. We work with agencies. The largest agency we work with is having a session in about a few minutes. CFC, Canadian Fertility Consultants, and they're both for egg donors as surrogates. And then there are lawyers that we work with as well that you can meet too, and that's your team that we assembled. Do you have any questions, or do you have any points that you want to add?
I think you made all the points.
Thank you, sir. Taught me well.
One question. During the process, what is the stage that you move out and the surrogacy agency is the one taking care of? Or
Sure.
Do you...
Right, so first of all, it is a I would say a seamless transition, but there are certain key points. So at this moment, you'd be working more with the surrogacy agencies and egg donors to match and pick who you're going to be using. But the way it works is, once you've selected a surrogate, that information is sent to us, and then that's when the nurse would be assigned and would reach out to the surrogate, make sure the medical assessment was performed, make sure that there's no outstanding issues on your side. We would take care of the surrogate, depending on where the surrogate lives. For the first 3 months, we provide all the medical kind of oversight, but usually it's up until that first ultrasound that we are directly involved. If they live far away, we would arrange for the ultrasound to be done in British Columbia, and then they have a separate doctor that would take care of them for the rest of the pregnancy.
Although we do keep in touch for the first 3 months, because there are specific things that a surrogate needs to have in terms of medical care for those first 3 months. So we always follow them all the way till that first 3 months, and then once they're past that, then they have an obstetrician or midwife.
But I guess the follow-up question to that is, so what if if it works, we know what to do. What if it doesn't work? So once the iburim are generated, then the agency is really not involved in the donation. The surrogate, we contact the surrogate and we arrange for the next transfer. The agency does not need to be involved in that part. We just keep transferring until we have to either reevaluate or until you get pregnant.
Another thing I want to mention, just in closing, because we only have about 5 minutes left, is that we will provide a consultation for your specific case for free. We can do one here tomorrow. We still have a couple slots. Or alternatively, we can do it by Skype, and we do not charge anything for that consultation. So if anybody wants to get more information and more detail, we need to know more about your own specific case, obviously, to be able to figure out how we're best going to meet your needs.
I asked if can combine your laboratory and your medical center with the American agencies and surrogates mother, so I can make the embryos at your clinic.
Yeah, absolutely.
And move it, transport it.
Now, the only thing about transferring to the U.S. is they may require specific testing, FDA-related testing, which we can arrange. Are you thinking about having the surrogate American or the surrogate Canadian? It's going to be much more expensive to have an American surrogate to carry. So you're really talking about a much bigger cost of insurance. And the lawyers in Canada are much cheaper. So if you want to do contracts in Canada, you're much cheaper.
There's an issue how legal is in actual practice to have not legal issues about having the child, the baby, back here to Israel.
Well, it would be a Canadian.
In order to avoid these issues.
Yeah, well, it's a Canadian citizen, and also it would be a dual citizen by getting your Israeli passport. But in terms of those legal issues, you would need to speak to our legal advisor, Cindy Wasser, who's here, and she can answer that question.
Okay.
And we can set up a consultation with her to get more details about that.
There's a session right after this one where Cindy will be there.
Yeah.
What room?
I don't know.
It's room 134. Here we have it. Actually,
Are you located in Toronto?
Toronto.
Yes, Toronto. So it's a direct flight from Tel Aviv.
Yeah.
Every day there's a flight, so it's easy to get to.
Air
She,
Canada.
What's
room
that?
1?
With Air Canada, no?
With Air Canada or LL, whichever you prefer.
LL does too.
Room 1. Toronto is considered one of the best cities in the world right now. It's an amazing place to visit. You have so much fun there.
Frozen.
And if you want to freeze the sperm, you just need to put it out of the window.
What's that?
Yeah. It says if you want to freeze the spring, just hold it out the window.
Yeah,
No, because now climate change is too hot for that.
Actually, it's pretty nice.
Yeah,
weather.
but but sometimes it's a good question though. You know, how do we coordinate it? So you would tell us before you're coming, we would freeze. Let's make sure to do this yet. You're like, I'm coming to Toronto. I want to do this in the next year, but I'm here now. As long as you contact us, we can easily arrange to freeze the sperm. I mean, it's not an emergency to do that, but if you want to link that up with the trip, just let us know you're coming, and we'll do it.
What's your policy regarding twins?
What's your policy regarding twins? So there's no formal policy on number of embryos to transfer. There's what makes medical sense. We both agree that single, live, healthy baby is the ultimate goal. And the safest way to achieve that is with a single embryo transfer, but there's no rules against twins. We will perform double embryo transfer as long as surrogate and you're okay with that. But you have to be careful because my policy is I'm very happy with healthy twins. I'm not so happy with unhealthy twins. And so we have to be very careful. I think that if we have a separate consult with you, we can discuss that, the advantages and disadvantages of doing that.
You're not recommending that in terms of statistic ratio.
I don't think that the benefit in outcome is not worth the benefit in risk. That's the bottom line. But I mean, absolutely. I mean, we have many successful. If you come to our clinic, you're going to see pictures of us holding twins. But you know, it's certainly something that has to be discussed on a specific basis because there might be reasons for that and reasons against that. Okay, thanks. Thank you. תודה רבה.
תודה.